presentation is about REACH, and we've got Jay, Maddie, me, and Rob. So today we're going to talk about what REACH is, how it functions, the current problem that we're going to address, our proposal, the timeline for that proposal, why we think it will benefit, some of the challenges that our solution might have, some of the value it could bring to the organization, how we're going to evaluate our solution, the logic model, and some lessons that we learned.
Alright, so a little bit about REACH. What REACH stands for is Rams Employment and Community Health Equity. This is a clinic that offers PT and OT services all for free. Stakeholders common at this environment is clients and caregivers, clinicians, students, and also funders. Eddie's going to talk a little bit more about the delivery model, but just to give you a brief background, currently services provided in person in an outpatient setting, and the clinic is held on Monday afternoons. The role of OT in this service, provide OT services at the clinic, also having REACH clinics and student development things that OT here.
So the current problem that is within the REACH clinic is that the REACH clinic does not have any standardized client profile sheets, and which that would provide the clinicians and the students of the OT and PT programs with vital background information on the client's current condition, past medical history, and other things of that sort. So therefore, the clinicians are required to collect this information during the initial eval session, and that impacts the amount of time spent with the client engaging in clinical procedures and assessments. And by implementing this new client profile sheet that we have created, clients, clinicians, and students of the REACH clinic will have more efficient evaluation processes to focus on therapeutic assessments more than gathering small semantic information about the client, just really helping with that efficiency.
So what we decided to do was create a kind of an intake survey to give to patients upon becoming new patients or just updating their profile. And who would be involved with that is like the receptionist, the people like checking people in, as well as occupational therapists, physical therapists, and students would also be using that in order to create interventions that are best up to date with that client. These surveys can be filled out paper form or online, whichever is easiest for the client. And the front desk could also help them run through it and understand different things that are being required on the survey. The cost would be relatively cheap, with the online survey being free, and the printed ones would be less than 10 cents per page. And then, Jake, you can pull up the survey. So it's a basic survey where we collect date of birth, full name, address, contact information such as email, phone number. They can choose to put in their ethnicity if they'd like, and then go to the next form. And this page, this is the same one.
You have to fill that out. That's fine.
It is. Go ahead and click next. So the next one is the emergency contact page, and they would just fill in a relative or a trusted individual and their contact information in case something did happen at the clinic. We would have that on file to better improve the quality of care for that patient. If you'd like to go to the next one. And then, like most clinics, we collect the medical history, including surgery, primary diagnosis for why they're being seen for therapy, as well as any secondary comorbidities that they might have that need to be included for the most successful interventions. Medication, so we can see about potential side effects or help with medication management more properly, and just overall just basic medical history, such as like medical equipment, like wheelchair, if they have, it kind of gathers like home environment stuff, so if they have grab bars in their shower, if they don't, well, we can address that and put that in there if they need it. It addresses fall risks, which is a huge part for grant funding, as well as preventing future fall risks if they have a history of that. It also covers emergency room visits and the reasons why, so that can also be addressed in therapy as well. Next page. Okay, and then this one is more client oriented. So we want to know the client's goals for therapy, so we can make it more personalized and client focused. And then anything else they would like us to know before therapy that would impact it as well. And also just feedback on the overall ease of the form, so we can update it and improve it so it's easier for the clients in the future. So we can go back to the presentation now.
Alright, here's our project timeline. By December 1st of 2024, we were looking to have a draft of the client profile sheet, and that will be given to the administrators at the Reach Clinic. By January 10th of 2025, all patients will have filled out the client profile sheet. By January 31st of 2025, feedback from the stakeholders will all be gathered. And by 6/1/25, feedback from stakeholders will be interpreted. By 8/15/25, client sheet will be edited based on the results of the feedback. And on 8/31/25, which is around August, all patients will all have filled out the client sheet for each semester.
Alright, so why did we want to do this? Well, first things first, for the therapist, it enables more informed care and increases efficiency. So going back to that other point I said, by being able to collect this data and information before we have to do an eval, that's what's gonna help speed up things and actually focus on therapeutic procedures. Next, for our stakeholders and the clinic director, it increases grant compliance due to the supporting data. So with all of the information that we're collecting, it will help receive more funds from the grant and actually be able to utilize everything that we have in store. For the intake staff, it increases avenues of contact for the client. So this way they can fill it out and we can have more detailed data, especially with the time restraints that we have whenever we have that initial visit. For the clients, there's an increase in quality of care and identification of situational influences. So in this way we can see a holistic view of the client in all the contexts and their client factors.
So there's a couple of different challenges that can be brought about with this change, like any change can cause. Forms can be incomplete if they're in paper format, or they'll need help. So that would increase burden on the intake staff. Some solutions we came up with that is if the forms are done online, it actually makes you proceed with the form. So you have to complete it all the way through, and then intake staff can help with both of these steps as required, and then we could educate intake staff on the importance of the forms and why they're needed. And then the last one is ensuring that these forms are HIPAA compliant. So we originally made our form on a Google Doc, but when we're implementing it, we want to put it in a program that's more encrypted, so potentially Microsoft Word or something more encrypted than that if we come across something that's more accessible to the program with the grants they have. And then paper forms would be in a safe and secure location within the clinic in order to prevent leaking of information.
Alright, so why is this valuable? Basically, it's going to increase the efficiency for us as therapists. Also, just give us more accurate information about our clients. This will also encourage time saved by clinicians and students. We will have to ask less questions. Of course, we would still have to do an eval process, occupational profile process, but we would just have more stone cold information on that client and what they're dealing with. Providing more direct client-centered care due to better preparation, like I mentioned before, That allows us to have a more holistic view, also what Rob mentioned, a holistic view of the client. That way we can provide better therapy. And it also gives us a basis for important questions to ask the client, such as fall risk, things that they're worried about as far as safety and occupational engagement. I'm sorry. The evaluation methods that we chose to use, strategy 1. The primary metric for the feasibility will be the completion of the profile sheet, the client profile sheet we mentioned before. And we would do this at the start of each semester just to have accurate and up-to-date information. Secondly, the data will be collected by comparing pre and post implementation evaluation times and identifying reductions in miswritten information. Just kind of seeing what's new, what's current, what's not, and what's been solved and what hasn't been solved. Also, a meaningful change, be clinician and student preparedness, leading to 5 to 10% reduction in the evaluation time will confirm workflow improvements, enhancing the quality of care.
So for our logic model, a lot of the resources we used are free online resources, like research articles. We've also looked at other clinics' intake forms and the evaluation forms used at the REACH clinic. Some of the inputs were reports and feedbacks from stakeholders like the REACH clinic director, students, and clinicians. And then the activities that we did were education on how the REACH administration can use this particular form and the benefits of it. And we learned from the REACH clinic staff of some of the problems they were facing with gathering this information ahead of time. And then our outputs were that there is increased information on patient conditions, medical history, contact information, and why different clients need therapy provided to the therapists and students before the client's first session. And then the outcomes is that there's going to be more compliance with grants, and those grants will be easier to track exactly that they're meeting those grant-specific outcomes. There'll be more prevention from complications, knowing more about why the client's wanting therapy and any relevant comorbidities they may have, and more holistic client care or client-centered care. And the impact is that each clinician will have an opportunity to provide better client-centered care.
So lessons learned, intake forms are important, especially to get feedback from clients. There are reasons why things are done a specific way, which we might not understand coming into it, but because we were talking with the people involved with the REACH clinic, we were able to tailor our survey better to meet their needs than what we thought they needed. That way it's more successful overall.
And lastly, the last lesson that we learned was one small change to a process can benefit a whole clinic. So this small implementation of this form can benefit each client and every person that is a stakeholder in this clinic drastically. And that was the point, was to make efficiency and client-centeredness and all in all, holistic care all into one.
Just to kind of elaborate on that, I think it really emphasizes the importance of advocacy. Really as a clinician or even as a student, just kind of stepping in, letting it be known that there are things in the process that need to be changed or things that could be more efficient, and just going or developing a plan to implement those things, because it can go a long way. Anything else? You can't really ask us any questions.
Yeah, there you go.
But feel free to send us an email.
And then these are some of the key resources we've used. We learned a lot through United Way, a few different research articles, the Intergenerational Center's website, and some information from the school's website about the Emphasis Fit